When you're saying expectations, I'm hearing pressure. The people that put the most pressure on themselves or have pressure from external sources like their employers or like school are going to be more likely to experience burnout. And I think we all kind of find our limits in life. Even in some areas, this is like a rite of passage. Like I said, rather than being embarrassed of it, you can actually be kind of like a badge of honor that you pushed yourself so much that you burnt out.
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
All right. Good morning, Andrew.
Good morning, Dave. How's it going?
It's good. This is, I think pre-recording, we were meeting with an old colleague and possibly having them on as a guest. So that's exciting. And
That should be fun.
yeah,
It was always a fun time.
yeah, reconnecting with some really great people. So that are doing some great
Exactly.
work. So
And this is episode 52. We've gone around the calendar once, and here we are. I think what I'm going to do when I set this up for episode 53, I'm just going to put it to season 2.
yeah. Oh, but we're doing a double episode today. So half this episode will be in season 1 and half will be in season 2.
But that's pretty cool, and yeah, I can't believe it's been a year and lots of fun. And what's been impressive is that I think we've always found topics to talk about when it comes to mental health, psychology, psychologist. It's so wide ranging.
Well, and even just behind the scenes again, so we met with someone this morning. Now, in between this double recording, we're meeting with an old prof from the U of A that hopefully will also be a guest that neither of us had really had contact with for probably 10 years. And it'll be so fun to reconnect and see kind of where he's at. And
Yeah.
yeah,
And for those who are not sure what U of A is, it's University of Alberta. So, it's a well-established school and a prof from there and a great storyteller. So hopefully it all pans out and we'll have all these people on.
that's been really cool too. Like we are not paying guests to come on and give their time and share their insights with us. So the fact that
Yep.
people are open to the idea of doing something like this with us is really cool.
We keep telling people it's volunteer work.
It's public service.
That's right. So if the college is listening, I'm doing my part.
All right. I know we're a bit tight for time today because of all the other stuff. We are going to be chatting about burnout. This has been something that we've floated around a couple of times now, and it's now at the surface. And so where do you want to start with burnout?
I think with burnout, probably defining burnout, what it looks like, what are the symptoms, what do people often associate with burnout? And I think right off the hop, it's just letting people know that burnout is not a diagnosis. It's interesting. This thought just floated past my brain here. It's a feeling. Like a lot of it is a feeling that you just feel. And perhaps you have some associated thoughts with burnout, but it's not a diagnosis. There's no set criteria for what burnout should be like according to some manual. But certainly there are diagnoses that are more related to burnout, and we'll touch on that as well.
Yeah, it's super important to know that, even if someone, a mental health person, tells you you're struggling with burnout, you can't go to your employer or your GP and say, I've been diagnosed with burnout. Like that, it is not a mental health diagnosis. But for so many people that are struggling with the symptoms related to burnout, having a word for it and then having some direction really can be helpful. I actually think this is quite similar to grief. Sometimes people are coming into my office and they're identifying it as depression. And then we look at like, well, hold on, what's going on for you? And then when we say, well, this actually is related to grief or this is related to burnout, And it's like, oh, okay, now I know what's going on, or I know what might be causing these depressive symptoms.
So, in terms of burnout, how about we start with some symptoms and some feelings of what burnout can look like?
Sure, and like everything, there's, unique aspects to it. So if you've experienced burnout, you might not have all of these, but some of the core ones, like the emotional exhaustion, kind of feeling like more cynical or more detached from the world and viewing the world in a negative way, like just I almost feel like there's a bit of a tipping point, like where things are hard, and then
Mm,
all of a sudden it is like
yeah.
really hard to take a shower, really hard to find motivation, to be interested in the same things that you used to be interested in. And it's just an overwhelming sense of exhaustion. And even as a runner, I think about like hitting the wall. Like
Mm.
you can be running a marathon, and then when you hit that wall, it is just like a big change in your energy and your ability to kind of do what you were doing 5 minutes ago.
And one piece I want to really stress too is that, in life, we will experience stressors and
Yeah.
we will experience challenges. It's sort of just the way it is, right? Something happens with a family member, and for maybe weeks ahead, it's going to be stressful. Or something happens at school with friends and so on. There will be stressful moments. So I don't want to come across as saying like any kind of stress can lead to burnout. It doesn't necessarily, and we should be able to get through a good level of stress. That's what keeps us going. But to your point, Dave, about just exhaustion, I think for me the word that comes to mind is drag. Like everything feels like a drag, and even things that were once maybe a little bit more excitable for you becomes a bit of a slog, and you might say to yourself, oh, I don't want to do that today anymore.
Yeah, like you said about stressors, we all have stressors, and moderate degree of stress is actually really good for us. It keeps us healthy, but once we cross that tipping point, for me it's more of like a global feeling. It's not just, you're doing something hard and it's difficult, and then your workday ends and you go home and you're, having a great time with your family. This is all of a sudden from when you wake up to when you go to bed, it's this chronic fatigue, emotional numbness, even irritability, loss of motivation, concentration problems, like how it affects the way you are able to think, right? And
Yeah.
problem solve. And then like withdrawing from other people, right? And some of that could come with shame. Like a lot of the people that I see that hit a burnout are like overfunctioners, are highly successful and have achieved a lot and really are embarrassed of like what is happening.
And I wanted to also put out there is that this doesn't just impact adults. I see this amongst teenagers as well, even some preteens. I think we live in a world today where we are doing so much. At least up here in Canada, living in Toronto, if you have the means, people are putting their kids into all sorts of activities. And it's not just for fun anymore. It's like, I want you to excel at the 10 things I put you into. And I've seen teenagers, preteens who also crash because they're trying to balance school with the expectations of how they do in school, but also the expectations in their extracurricular activities. And it becomes a lot.
Yeah, when you're saying expectations, I'm hearing pressure, right?
Hmm.
And the people that put the most pressure on themselves or have pressure from external sources like their employers or like school are going to be more likely to experience burnout. And I think we all kind of find our limits in life. So even in some areas, this is like a rite of passage. This is like like I said, rather than being embarrassed of it, you can actually be kind of like a badge of honor that you pushed yourself so much that you burnt out, and then you took some time off of work, and then you came back and you push yourself again until you burn out. Like there are certain professions that is kind of the pattern.
I think in every profession, you can push yourself into that pattern depending on what pressure you or your bosses put on you, right? For some people, it's very interesting, I think, actually, is they put it on themselves, right? And it's almost this idea sometimes like the burnout that I've seen from some of the adults I work with is when things are no longer in their control, right? So my boss wants me to do this and this and this and this. And you just feel like you have no autonomy to choose, to set your own deadlines if needed, or even go to your boss to talk about how many things you have on your plate.
Yeah, so we're touching on, not only like what it might feel like, but also what are the causes now, right? And so that's why it's kind of helpful to say, "Oh, I think you're experiencing burnout." And then the
Yep.
person goes, "Oh, okay." Because if burnout comes from pressure or from, lack of autonomy or control over your life, your environment, then now we can look at how can we find that what work-life balance. I don't really love that term, but how can we find more balance in your life so that you're not completely exhausted? Yeah, and I have a couple of metaphors that I like around burnout, so I'll touch on that in a minute.
I know we've talked about work a little bit, even in the short time that we've been discussing this, but it's not just work. Burnout doesn't just come from work. Like I've mentioned, school, peer groups, home life. When, you've got a family that needs you, that requires your assistance for many things. Again, pressure, right? To your word, you feel pressure even at home to perform a certain way, right? So that in combination with all sorts of other factors in life lead to burnout.
Yeah, yeah, I think like you're saying, I often tell people like the stressors in your life can compound, right? So on their own, those stressors wouldn't be overwhelming, but put together, they're actually like exponentially harder. So, really looking at like, well, I don't have that much. Like a lot of people will minimize, like, I'm just doing this, this, and this, but trying to do all that in that time, like the pace of things is also super important, right?
Yep,
Like how quick you're trying to do things or get things done is going to
yep,
affect, yeah. So I think about
yeah,
chronic stress, right? When we're looking at causes, that pressure, that chronic stress where you don't actually get any relief or a break from the pressure or the stress that you're under, and
hmm.
eventually the system crashes.
And it can also lead to, when you talk about the chronicity of stress, physical symptoms, right? So your body, not just your mind, but your body starts to break down too, right? More aches and pains, more illnesses. So, your immune system is just not coping.
Your
So,
digestive system, your immune system, like all of these systems that are reliant on the kind of rest and digest area where you're not, when you haven't got to your parasympathetic nervous system kind of
mhm,
range. So one of the metaphors that I love and that relate to a lot of people, especially men, is the like the vehicle and the revving of your engine, right?
yep,
And so your RPMs. And I'll often ask people when I think that they're on the edge of burnout is like, are you redlining it? Right. And so
yep,
there's every vehicle, or at least most vehicles that I know of, there's an RPM gauge, and at certain point in that gauge, it's red, right? So if you're revving in that zone, it's a high risk that you're going to do damage to your engine, right? And the engine could
yeah.
actually like blow up, right? So oftentimes people that are prone to burnout will push themselves, and hopefully when they get to that red zone, they back off a bit. But if they don't, then they end up burning out.
Yep. No, that's a great analogy. Your engine just can't take it anymore, right? And so it just blows up. I like that when you just said it blows up. I had this sort of image in my brain, like just the whole engine just catching fire and
Yeah, you're not going anywhere. You were going 100 miles an hour and now you're going nowhere. Your
exactly.
smoke's coming out of your hood and you're on the side of the road.
Yeah. So like that piece is like you just feel completely worn out, right? And it's for a period of time. So, like you mentioned, we can feel like we're really exhausted, maybe for a couple of days in a row, or maybe there's one week that's been a really stressful week, but then we also have the intention, and we'll talk a little bit more in our second episode about this, but we have the intention to pull back, right? And we'll say, okay, next week is a little easier. This is what I'm going to do. But it's when it's weeks on end. and you just feel like I need to do this for the family. I need to do this at work. I need to do this for the social group I'm a part of, and nothing is letting up. You just feel like the pedal is to the metal without any relief.
Yeah, and I was thinking like for the general population, that is absolutely true. And like looking at people that have more of a perfectionistic tendency or take on a lot of responsibility, even like overcommit, they're the ones, leading a bunch of committees and,
Hmm.
signing up for things or not saying no to things,
Hmm.
right? But the other population that I think about is people with like a brain injury where or even a physical injury where all of a sudden their limits have changed. They used to operate at a certain level and their limits have decreased. So we're often looking at pacing, we're looking at the amount of activities or things that they can do. And it's frustrating because they're like, this is so easy. It shouldn't be, it shouldn't be this hard. It shouldn't wear me out. And I need a day to recover from going out to a social event, right? And so really adjusting those limits is challenging for people that those limits have changed pretty drastically in a short amount of time.
And I think too, everybody has their limits, right? So this is the other piece that I often see is that people may compare and say, well, I should be able to handle all this stuff because my counterpart sitting over there, or a coworker tells me all the stuff that he or she does, and they seem to be completely fine. And so I should be able to do it as well, right?
Yeah.
That I find to be a common pitfall in the way we think.
Yeah, and we haven't done CBT yet, but shoulds, right? And how much you
Yeah.
should on yourself in terms of, comparing yourself to others and really kind of telling yourself that you either should be able to do this or shouldn't be able, or any of those absolute statements can
Yes.
really, yeah, increase the pressure we have on ourselves. So
Yep.
changing that should to like, it would be nice if I could do that,
Yep.
really can change the way that feels in your nervous system.
And also too, like sometimes what I see clinically is the person who is experiencing burnout goes from, again, very controlled pressure, feels pressure, have certain expectations, but then all of a sudden it's like, I don't care anymore. I care about nothing. Don't bother me with anything. I don't care.
Yeah, I just want this all to go away.
Leave me
I want
alone.
to, yeah, I want to,
Yeah.
I want to quit my job. I want to move away. I want to go live in the bush somewhere or like on some island. Like just, it all feels too much.
Yeah.
And so moderate amounts of stress feel like too much.
Yeah.
Whereas before you could handle the moderate, even kind of high stress. So
Yes. Yes.
sometimes sometimes I see people like over the years, I've been able to see people only when they burn out, right? Like they'll
Yeah.
come in, they'll be struggling, they get some help, they leave. I don't see them for a while. And then a year, 2 years, 3 years down the road, they're back, right? And so it can be kind of a chronic pattern too, that people need to kind of, it's hard to change these patterns once they're well established.
Moving from that, like just describing and illustrating what burnout looks like in different populations, there are associated mental health disorders with burnout. And so, like we mentioned at the beginning, burnout is not a diagnosis, but something like depression can be associated with burnout. Something like panic attacks or panic disorder can be associated with burnout. Same with anxiety,
Hmm.
any kind of anxiety disorder, right?
Chronic fatigue, right?
Yep.
Yeah.
Yep. Substance abuse.
Yeah.
So certainly there are associated challenges and disorders that are associated with burnout if it's not managed well.
Yeah. And I mean, burnout is not just like, oh, it's a lack of energy and you just need to take some time off, right? That that can be helpful, but if you go back into the fire after, it's not going to be good. There needs to be kind of lifestyle
Yes.
changes in order to not only prevent burnout, but like thrive, like actually for your wellness to you don't just want to be bouncing on back from the red line every time, right? Like there's a cost to pushing yourself that much, and you might not feel it right away. But like you said, physically, emotionally, mentally, these things do kind of wear you down.
Yep. Yep. So that wearing down piece, I think is so important. And it's not all the time where it just comes, right? It's almost like the way I'm envisioning it right now. It's like almost like a shaving, right? Like when you shave cheese, it's like you just wear down that block of cheese over time to the point now it's getting close to your fingers, or you have no cheese left. You're trying to scrape off just the tiniest bit left. And I think, that is where some of these challenges will come in terms of feeling depressed. Or you get to the point where you all of a sudden have this panic, like nothing is in my control. I've tried to hang on to that control as much as I could. I've reined it in as much as I can, but everything, like you said, it's blowing up.
Yeah, and so if we start looking at with the time that we have left for this first part, just like what people can do, right? And so I think a lot of times, people will get they'll go off work for a while, right? They'll get a letter from their doctor because they actually can't perform at all. Like that they hit a roadblock. And so, but our system, the way it's kind of set up is people will have, they'll go from full on to nothing and then have to pick a time to return. So they'll get like 3 to 6 months off of work and then they go right back into work as it was when they left. Right. And that is not actually ideal for this. And when I'm working with, people that are off work, if they're on like a WCB, like a workers' compensation, or there is an insurance company involved in their
Hmm.
return to work, I'm advocating for like a gradual return to work. I'm advocating for looking at reducing some of the demands at work and finding that balance where this person can perform optimally and not be back, off work again. But it's hard because our doctor's notes don't often do that. Like I have seen the odd one where the doctor will prescribe 1 day off a week instead of fully off for a period of time. But employers also struggle with that too. They're like, what do you mean? Now this person is only 4 days a week instead of 5 days a week. That doesn't really work for us.
Yes.
But if you understand burnout, this makes sense.
I've also found too, this is so interesting that we're talking about insurance companies and workers' comp. The individuals who are experiencing burnout, again, typically, I'm not saying this is everybody, but typically these are individuals who put pressure on themselves or experience pressure. And then you get this third party that comes in, and now they're requiring documents. They're requiring a diagnosis, and they're requiring you to call them back as soon as possible. But then when you call back, no one's picking up. And so it you're smiling, I'm smiling, but it's the ironic piece around what companies and third parties are expecting. And it actually contributes to that stress and that burnout that the person is experiencing because they want to get things done for the insurance company. They're asking for this, they're asking for that. And it's just like, this is not helping.
Well, yeah, the help is not actually helpful, right? And
Yeah.
so, yes, getting supports are great, but if the process of getting those supports and I know doing a little bit of work with, insurance companies and WCB is that, they require people to actually be compliant, right? And so if people don't make their appointment or if they're not taking their medication or if they're not following the treatment recommendations, they'll be deemed non-compliant and they'll lose their benefits. And that is really stressful, right? So you have these people that are possibly already kind of type A
Yeah,
and like to make sure they're doing everything correctly and then are being threatened or they fear that they will lose everything if they make one
exactly.
mistake. It can actually contribute to being off work longer in some
Yes.
cases. Yeah.
Yes. Or sometimes they're told by the third party, hey, you're gonna go back on this particular date. And
Yeah.
it's like, what? I didn't know that. And again, it's just like the panic that sets in, the anxiety that sets in.
Yeah.
It's intense. Yeah.
Well, and for mental health folks, right, to be able to work with the insurance company and explain that this might be affecting the recovery, right? That this is a factor that So having the individual have more autonomy, more say in terms of how they
Yes.
return, what department they might return to if it is work, right? Like
Yeah.
not just being told this is what's going to happen to you.
Well, the back to your point about autonomy, right? That's where it's really tough. Like again, they feel like they have no control. They're
Mhm.
being told when to go back, not having any kind of discussion or collaboration to say, "Hey, can we talk about this a little bit before we decide?"
Yeah. And so, again, going back to what people can do if they encounter burnout or if they're on the brink of burnout, right? Like, if you can kind of sense, like, oh no, like I've done this before, or this feels different, like I'm on the edge of going over a cliff, really looking at your demands, right? And what things can you take off your plate right away, right? And then what things might you have to work on over a longer period of time. But that's what I'm typically helping people with. And
Yeah.
sometimes it feels like I have to do all of this. There's nothing I can not do. And it's like, okay, let's regulate our nervous system a bit, take a step back,
Yeah.
because it's hard to problem solve when we're overwhelmed and or we're exhausted, right? And so, yeah, really even just writing things out or asking questions like, what would happen if you didn't do this right now?
I almost see it as you're teeter-tottering back and forth, and you sort of know when you are about to take that step over, and I think it does require some self-awareness and insight to know when you're about to cross that line. And sometimes people are a little bit taken aback because they've crossed that line without even knowing it until it's really hit them in the face, and then they're struggling in every facet of life.
Yeah, actually, like a contrast to the people that I end up seeing just when they burn out is the people that I see kind of spaced out a lot more, but it's almost
Yes.
like a check-in. It's like
Yep.
a, okay, let's assess how I'm actually doing because I don't typically take the time to, to do that, or it's hard for me to do that self-assessment piece,
Yep.
right?
Yep. And it's being really open-minded to what people close to you are also trying to communicate. I've worked with spouses and partners and children, teenagers who will say that my partner doesn't seem to be like themselves,
Hmm.
right? They just seem really down. They don't want to join me for anything. They've
Or
been complaining about work all the time. Sorry, you've got one.
or irritable, like kind of the
Irritable.
opposite
Yep,
of
very
that,
irritable.
right?
Yep.
So snappy, irritable. It's like, ooh, like
Yep. Not taking care of themselves.
actually, I'll make a plug for one of the previous episodes around with boundaries, right? Because boundaries is another thing that I'm helping people with in terms of like how to find that balance or be able to manage the stressors that are going on. And so the type A or the perfectionistic type of personality, but also the people pleasing, right? And the people that don't say no to things all of a sudden, depending what's going on in your life, you might have more than you can handle, and you just keep trying until you crash or blow up. We were saying, being able to check in or have other people notice, having a social support system,
Hmm.
right? And sometimes there's like executives, top end kind of business owners, and they have a group of other business owners or other executives, and they meet up every couple of months. And that's a way of like checking in and kind of getting a sense of how am I actually doing? You know, do I need to make adjustments?
Yep.
Ideally, you're making these adjustments before you crash, right? And
Yep.
yeah.
And there may be minor adjustments or even major adjustments. Sometimes I will work with people or I hear of people who have made some major life changes in terms of walking away from what seems to be maybe a very lucrative career and trying something else. And I think it's so important for us to not criticize because who knows what the person was going through, right? Maybe it was no longer worth it.
Yeah, and people do make major changes, and sometimes the only way to change this is a drastic change, right? So I think when we're helping people, we're looking at does it need to be a drastic change, or can you make these adjustments in the situation that you're in, and it becomes more manageable and more meaningful, and you get your spark back, you get your kind of interest back. So I think we're probably going to leave it at there for this first part. I will just summarize a little bit and say when you're looking at like what can you actually change if you're feeling like this. First of all, you probably need some help. You probably, if you're in burnout, you need someone else objective that you trust to kind of support you with this. But once you're out of that burnout and you're kind of got it back to to together to some degree, you're looking at what kind of behavioral changes you can make, what kind of cognitive like thinking patterns you can change, and then environmental changes. And you might even like create three columns and start to go, okay, where are the areas that I can start to do some of this so
Yeah.
that I am healthier and happier and more myself.
And I would add a fourth column. Who can help me with this change? What or who might be able to assist with this change?
Yeah,
Because to take a bunch of changes on personally can also be very daunting, right? So reaching out for help.
absolutely. All right, to be continued. If you like this, click like, subscribe, spread the word. But we will be doing part 2 on burnout, and it's going to be a little bit more personal in terms of like people in the helping professions. So, yeah, stay tuned.
And take good care.
Take care.